For your health now, we're always told how important our mental health is, but when there's a lack of therapists, especially ones of color, who do you turn to for help? New tonight, Taylor Lumpkin looks for answers.
We really need more. We desperately need more.
Simone Kilgore, a counselor in Milwaukee, says because of the COVID-19 pandemic, one of the most challenging issues people are facing in the city and across the country is finding a mental health service provider.
The need for services is on the rise. We can't, sorry to say, meet the needs of all, but we're trying our best to do that.
But she says what's also on the rise is the need for mental health service providers of color.
Right now in Milwaukee, the wait list with Black clinicians is off the charts. There's just a shortage of Black therapists, and it probably will be for many years to come.
According to the American Psychological Association, in the country, 83% of psychologists are white, 6% are Hispanic, and only 3% are Black.
I've seen this more times than I could probably count over the time I've been working in mental health and psych.
Veronica Powell, a nurse practitioner in telepsychiatry, says for Black Americans in Milwaukee, finding a mental health provider that looks like them is crucial to destigmatizing mental health within the African American community.
Mental illness among people of color is heavily stigmatized. And I think that would break a lot of barriers for them to be able to see therapists and psychiatrists that look just like them.
So how did we get here? According to some health officials, years of educational barriers and the lack of exposure people of color receive about the mental health field have kept them away from the industry.
Race matters, and it has affected Black folks for hundreds of years. Removing educational barriers is a major factor in terms of getting folks to that finish line.
And they say the only way to start getting more people of color interested in the mental health field is through a strong recruitment and education presence within schools.
Recruiting from different universities and colleges and stuff, and encouraging those roles might be good among people of color.
We have to get in there and dismantle the way the system has always kind of kept Black and brown people out.
Until more people of color are in the industry, mental health officials say, unfortunately, they simply won't be able to fulfill the needs of the community at the level that they'd like to. In Milwaukee, Taylor Lumpkin, TMJ4 News.